Okay, everyone, sound check. We're all good? Board members can hear? Okay, so 5 o'clock on the nose. I'd like to call this meeting to order. So first off, I guess I'd like to have some introductions of our guests. And so tonight we have Staff Sergeant Dean Korn. So thank you very much for being here. And you are our acting inspector this week, or for the month. So Terry Ward is not with us tonight. And we also have, would operations manager, staff sergeant, do we say both? Yeah, okay. And John Bulligan's here, so thank you very much for being here, sir. And then we also have Constable James Giovanetti and his team here tonight. So thank you for being here, guys. And the library board is here tonight, so welcome everyone. So we'll call this meeting in order, and at this time, board members, disclosures of direct or indirect pecuniary interests. Anyone? Seeing none, how about a motion to approve the agenda? Board members, can we do that? Mayor Post, Member McSweeney, all in favor? Yes. Okay, thank you everyone. So we are in public session, and at this time, we're on item number 6, and I'd like to have a call up Sherry Marks, who is the chair of the Orangeville Public Library Board, and she will be doing a presentation. Ms. Marks?
Good evening, Chair Taylor. Thank you for allowing us to address you this evening. I'm, like you said, Sherry Marks, Chair of the Orangeville Public Library Board. With me today is Darla Frazier, our CEO, Bill Ray, our past chair, Catherine Creelman, our Public Services Librarian, as well as David Waugh, one of our new board members. So we requested this time to discuss from one governing board to another, how we might work together to fulfill the goals of both the town of Orangeville and the library's new strategic plans. Last October, the library released a 5-year strategic plan with 5 core values and 3 strategic directions. Our vision for the library is to be the place for everyone to connect and discover, where learning and possibility allow each community member to soar. One of our core values is inclusivity. We support and protect accessible, equitable service that respects the needs and individual experiences for all. Everyone is welcome always. To meet our goal of becoming a welcoming and inclusive place, we need to partner with organizations across the community, including the police. As I alluded to, we asked for this delegation to formally renew our relationship with the Orangeville detachment of the OPP. We value the support that local police have provided in the past, and we want to strengthen that relationship for the future. Being a welcoming and inclusive place for all means that we reflect what is happening in our community. Vulnerable people experiencing challenges such as mental health issues, addictions, and homelessness turn to the library. We provide space to sit without a time limit, provide access to public computers and Wi-Fi, and have public washrooms. We are also a warm space in the winter and a cool space in the summer. For much of the time, customers using our services experience a safe and secure environment. However, there has been an increase in disturbances that can interfere with the use and enjoyment of the library. Another of our values is intellectual freedom. We provide access to diverse expressions of knowledge and ideas that inspire freedom of thought. Unfortunately, our staff are seeing the growing polarization of our society, where challenges to intellectual freedom collide with library collections and programs. This is resulting in friction between intellectual freedom and the principles of EDI, equity, diversity, and inclusion. Moving forward, the library plans to continue to be one of our community's flag bearers for intellectual freedom and to act as an example to other organizations regarding equity, diversity, and inclusion. To empower our staff to deal with their role in ensuring a welcoming place for all, the library has invested in staff training, which includes dealing with difficult patrons, mental health first aid, and de-escalation skills. We have built our capacity to provide empathetic service through various sessions like the Bridges Out of Poverty and the online support from Ryan Dowd's experience working with the homeless. As well, we have made connections to community service agencies that assist in vulnerable populations. All training and support is to give staff the confidence and skills to safely resolve the challenging situations they may encounter. There are policies, procedures, and security features, cameras and panic buttons, in place to protect and support staff prior to, during, and after incidents. The library also makes good use of the town's R-Zone policy, which is rooted in the premise of respect for yourself, respect for others, and responsibility for your actions. This behavior management protocol has been used successfully in the library for years. When specific patrons are unwilling to follow the policy, their library use is suspended. This is a last resort, utilizing the authority granted through the Public Libraries Act. As we settle into this new term of Office for Council, we want to open the conversation with some unknowns identified by the library board and the staff. The first is, in those instances that do not warrant a 911 emergency call, we'd like to know what is the proper way for library staff to ask for assistance. In the past, we would call the non-emergency line for like a walkthrough. And the second item is, what is the response the library staff should expect after making that call or requesting assistance? Those would be two helpful things for us to know as we move forward building this relationship. I believe our library staff go above and beyond managing incidents in a way that respects individuals involved, de-escalates tensions, and keeps everyone safe. However, there are times that the police are needed. We can't go it alone. Libraries are not immune to the challenges that people face in broader society. We are here to support our community, but it is essential that the library is playing the right role. We are not a shelter, and we are not healthcare professionals. Through ongoing conversations and partnerships, we can provide support to those in need while serving the broader community. So we look forward to working together, and thank you for the opportunity to present to you this evening.
Thank you very much, Ms. Marks. How would we like to approach board members? Do you want to comment on this, or shall I go right to our acting inspector? Board members, can you hear me? Yes.
Yeah. I think that's the best first step.
I agree. Very good. Okay. Acting Inspector Corn, did you want to speak to this?
Speaking with John, we were discussing this. That's better. To increase foot patrol, most of our platoons are doing a foot patrol daily, and I don't think it's going to be a problem to just have the library incorporated into that. We are also in the process of hiring an officer who recently retired, that his duties will be blended between the courthouse and a downtown foot patrol officer. And again, that can be incorporated into the library, as I think was done in the past. And I think we...
Location, once Mill Street is currently closed, but once it opens, as well as all the...
I believe so.
Yes. Absolutely wonderful.
Yeah, and just to top that up, we can also after with that, so we can get that afterwards from you.
Great, thank you so much.
So, Mr. Chair, I have a question. I think that Sherry raised two interesting points. I don't know if the police service representatives here today want to deal with it in real time, but I thought they were pretty good questions. So, what, short of calling 911, what should library staff do if an incident does arise? Often those kinds of incidents, it's difficult to assess. Just how difficult they will be, because things can escalate quite quickly. So that's number one. And I think I heard the second question is, and during the interim, what should staff be doing to sort of contain the situation, or at least, pending assistance arriving, what should staff be doing?
I would say that there would never be a problem with calling 911. I mean, we would not ask the library staff to ever put themselves in any sort of safety or jeopardy or anything like that. It would be best to just disengage, call 911 or the non-emergency line, and a call will be generated and officers will be dispatched. Sorry, does that answer the question?
Well, the second part of it, which is probably a little more difficult, what should they be doing? I'm assuming, Sherry, there's no, so is there a security guard that is at the library?
No, Ian, there would not be. And really, the library staff have no concerns calling 911 when they need to. That's why we've have the training in place with the de-escalation, and they have a lot of tools. They are an incredible staff. What we'd like to know is when we do get to the point where we need to make a phone call, what should we expect after making that phone call? Are you when we call the non-emergency line, or if there is a non-emergency line, is that going to be on like a rotation where someone will stop by? Do you come and connect with whoever is making that call, just so that we put some type of process in place, or so we understand what happens once we make that non-emergency phone call?
Yeah, so it depends on what type of call, what type of incident it is. It may be an incident that the police just call you back if you don't need them there. But if you do need them there, then, and you've called that non-emergency line, then an officer will attend. So it can really depend on what the nature of the call is.
So during that call, we should probably just explain whether we're looking for someone to stop by or we're just looking for a follow-up phone call.
Yeah.
That would probably be helpful.
Yeah, tell them what it is that you're looking for, and they'll pass that on to the officer. And, you may say, we just want a phone call, but the officer may deem it necessary that they come there. So, yeah.
They would be the experts, so we will defer to them.
Right. Yeah, if that helps.
Absolutely. That would be great.
Okay, Ms. Marks, did you have anything further you'd like to discuss, or is
to build a great relationship going forward, and look forward to seeing random walkthroughs as a really huge impact, and build the relationship. We just are looking, like, stop, talk, interact, please.
That's great. Just as a sidebar, you are not the only public entity that's having issues like this. So our rec centers are experiencing similar issues. So anyway, we thank you very much for bringing it forward and for being here today. It's great. So Ms. Marks, thank you for your presentation. And Ms. Fraser, it's wonderful to see you. And Mr. Waugh, wow, it's so exciting to see you in a public forum. So, and Ms. Creelman, thank you. Even you, Mr. Ray, thank you for being here. So appreciate the library board, and thanks very much for this. It's great. Okay. Okay, so board members, we will make a motion to receive that report, I think. Is there any other follow-ups that you'd like to have? Member McSweeney, you'd like to speak to that?
I was just going to make the motion.
Okay, motion made by Member McSweeney, followed up by Ken. All in favor? Yes. Okay, thank you, everyone. So item number 7, we've got Constable Giovanetti, and thank you very much, Mona. Constable Giovanetti, I'm going to turn the floor over to you, and you're going to educate us on the MCRT. And thank you very much to you and your team for being here.
So Mary Lou, if there's an oral component, Ken and I are not getting it.
You just need to be patient. We're playing around with the PowerPoint.
No worries.
Just here. Yeah, just be here in a second.
I guess it's not displaying the entire screen, but that's okay. So my name's James Giovanetti. I am a provincial constable with the OPP. I am here at the Dufferin Detachment, and my assignment is as the Mental Health Liaison and Mobile Crisis Response Team full-time officer. Beside me here are Angela Armbrister and Michelle Marr. Both are registered nurses who specialize in psychiatry and addictions. Between the two of them, there's over 50 years of amazing experience, and both of these ladies are employed by Headwaters Hospital. Switch to the next. Sorry, I thought someone said something. So the evolution of Dufferin's MCRT. So initially we started off with a singular officer, which was me. And our crisis response consisted of a call for service. And then I would be looking to some of our community partners to do a coordinated response. What we found was that it wasn't meeting the needs of the community and the people that we were serving. It was identified that we really needed an embedded unit, meaning that we would have a clinician in the detachment with us who was able to service the lifespan, meaning regardless of a person's age, we would be able to bring a specialist, a clinician with us to the scene immediately to assist, de-escalate, and ensure safety. With that being identified, we approached Headwaters Hospital, and they indicated that they wanted to build a relationship with us. We subsequently wrote a grant to the Solicitor General's office, and we were successful in receiving the MCERT enhancement grant that was put out by the SolGen's office. So as it stands now, there's myself as a full-time officer. We have our two crisis nurses, and we also have 4 part-time officers who have received crisis training. So on days that I'm not working and we have one of our nurses in, those officers will be teaming up with our nurses, and they'll be responding to crisis calls as well as other calls that are happening throughout the community. And it's important too, the formation of this team came at a really good time. Because back in 2020, I believe it was, OPP started a review of crisis teams throughout the province. And earlier this year, the report was released, and the OPP is looking to standardize MCERTs across the province. So we're going to start looking quite similar regardless of which community you go to. Dufferin's model, we call it it's a blended model. And what that means is that we are responding to calls for service in the moment. So if we are on and available, and there is a person that is in a crisis, whether they have a mental illness or not, a crisis doesn't discriminate. And we will be dispatched to deal with that in the moment. One of the things that we do as well is we will review calls, and we will look for risk factors that we're seeing in these calls. So although it may have come in as a family dispute, for example, reading through the call and looking at the involved parties, sometimes what we're seeing is a person who we know has a mental illness and perhaps is struggling. And we can see that it is going to continue. The behaviors may escalate while the person continues to decompensate. So what we're trying to do is get in there as early as we can to intervene before it becomes a situation where someone has to go to hospital. There have been times where, we're looking at these calls going, okay, let's do that intervention. And when we get there, what we're actually arriving to is a very, very unwell person who needs assistance. And there have been instances where we think we're going to try and intervene and prevent a crisis from happening, only to find out that it's well underway, and we're very happy that we were able to get there in that time frame. If we can switch to the next one, please. I just want to touch on data collection briefly. What you're going to be seeing in the further slides is from December 1st of last year to April 30th of this year. And the reason for that is because it's a police hospital partnership. There's been a different emphasis on the kinds of data that are being collected. So what we're finding, like during grant report periods, and just from speaking with other MCERT teams and hospitals, is that there's better ways for us to collect data. And that's still an evolving process. The hospital has recently upgraded or made some changes to their software. So it's going to be a lot easier to track things, for example, like a community referral. What we have right now is a very archaic checkbox system on paper that we assemble at the end of each month. But what we're looking to do is hopefully eliminate not just the paper piece, but also the human error that may come into that by having it all digitized. So I wanted to bring your attention to this graph here, and I'll explain it. So between January and April, what you're going to see are 4 different bars there. Now, the blue ones represent 2022. And those were the number of calls that had a mental health related component. And what we see from 2022 into 2023 is we have an increase in the call volume. The call volume is going to be the gray bars. Of particular importance when we're looking at the efficacy of any sort of mental health response is whether or not we're able to divert people from hospital when they are in a crisis situation. What we're trying to do is reduce the number of people that we are apprehending and taking against their will for treatment. And there's a few reasons for that. One, it's not always helpful for that person that's in crisis. It may prevent or it may provide safety in that moment for them, but that may not be what's going to be most helpful for them when they're looking at a long-term solution or treatment for their disorders. The other piece, and sometimes we have to look at numbers and treat it like a business, it's not efficient. It can be far more efficient for an officer and a nurse to spend 60 minutes speaking with someone and letting them have the floor and the opportunity to get things off their chest to a professional who is able to pick through what it is that they're saying and find the services that are best able to help them. Now, if we were to look at the apprehension numbers, what we'll see is beginning in September of last year, you're going to start seeing a decline. Now, I understand that October is sort of we're going to have those months where we are apprehending more, but there's a general downward trend. And that's something that we'll speak to a little bit more in the following slides. One of the things that we do is ensure that we are getting referrals to community providers. We know that people will receive the best treatment when they are out in community. We are partnering with, I'm reluctant to actually use the word partnering, but we're certainly building relationships and working collaboratively with different community agencies. And what we're really trying to work hard at with MCERT is to represent the community that we're serving. And one of the organizations that we've been able to build a relationship with recently would be Punjabi Health Services, where we can see that we are definitely getting a larger South Asian community within Dufferin County. And what we're wanting to do is make sure that when we are attending these calls for service, we are able to engage or lean on community agencies that really have a true understanding of the culture and some of the intricacies of dealing with mental health, depending on a person's background and culture. To be honest, before meeting my partner Michelle here, I had never heard of Rainbow Health Services. And Rainbow Health Services, for example, is a service that is dedicated to assisting persons of the LGBT community. We work with Family Transition Place, DCAFs, Victim Services, CMHA, and between December 1st and April 30th, we sent out 227 different referrals to service providers. And this is one of the strongest pieces to having these nurses on board. Before we had them with us, we would essentially put out a referral to maybe 1 or 2 community agencies, and we would leave it up to them to follow through with that. But what we're doing now is having specialists who are able to assess a person's needs and get them connected to the proper services faster. So we can. And these are just some quick little stats. So again, December 1st to April 30th, we attended 349 incidents. And that also includes some proactive. Out of those 349 incidents, we apprehended 25 people. So that's a 7% apprehension rate when we're interacting with members of the community. We've seen a decrease in ER wait times for police. And we also provided 264 hours of direct care to persons that were struggling. And when we look at it, you know, that 264 hours that we spent in that time period could have been significantly more had a person gone into a full crisis, needed to be taken to hospital. You know, sometimes we are finding ourselves being called by officers to what appears to be a criminal-only scene. And what we're finding is that there could be many members of a household that are living with a mental illness themselves. So we're finding sometimes that we're putting out multiple referrals within one household for multiple people. And one of the organizations that we refer people to as well is for the family members that are living with people that are living with mental illness. Because it's truly not just the individual with the diagnosis, it's the people around them as well that need support, that often get overlooked. And that's one thing that our nurses are phenomenal about doing. Don't know if I don't think I have any more.
Board members, any questions that you'd like to ask? I have a few if no one else does. Yes, Ian, you'd like to go ahead?
Thanks, James. That was a great presentation. I have a question that relates to your, I think you originally called it a partnership and then corrected yourself with the other agencies, mental health and other family and child agencies that operate in Dufferin County. So I'm curious, in addition to the referrals, when you attend an incident, and as a result of interviews and your assessments with respect to that incident, you make a referral to one of these other agencies. I'm wondering if, in addition to that, you are determining whether or not the individuals involved are already clients with active files of one or more of those agencies, and in that case, contacting those agencies with respect to the incident. You understand? Like it's a bit of a different kind of a slant to the referral. Yeah.
No, that's actually one of the first things that we do when we arrive on scene to any sort of crisis call is try to determine if someone is already connected to service. The next piece would be whether or not we receive consent from the individual to contact their current service provider. And one of the unfortunate realities for us is that very, very often people are connected to a service provider already. And I say unfortunate because we're not talking about any specific provider, but if someone has reached a point of crisis that the police need to get called, that means that the system has failed them. And that doesn't mean that any individual organization or any individual therapist or worker has failed the person, but globally as a society, we are not giving this person the care that they need to be successful and stay out in community. Sometimes we will have reluctance due to negative past experiences that people have had with organizations. And in those cases, what we actually try to do is go back and build a relationship with that person. So we may end up visiting them 2 or 3 times to build that rapport and trust with the intention of being able to do a warm transfer back to that social services agency. Does that answer your question, sir?
Yep, it does. Thank you very much.
Very good. Board members, anyone else have a question at this time? No? I was just curious on 2 things, if I could, James. One is the ER wait times. I think I know what that's about. What you're suggesting is in the past, so officers had to wait there because it was a danger to the people that were in the hospital and visiting the hospital. And now through this intervention, you've been able to cut that down. So I'd just like to hear a little bit about that. And then the second question, I guess, and maybe it goes to you, Michelle, but I'd love to hear, like, you're not a police officer, right? So what's that like? This is quite different what you're doing. It's very unique. Love to hear your perspective on that as well, if I could. Maybe that's my wrong question. One for you, James, and maybe one for.
Okay, so I'll answer that first. So one of the benefits that we have of having our nurses with us is that it allows them to do some of the work that the ER nurses would be regularly doing. So previously, when we would apprehend, we would be going through the triage process like anybody else, and then it would create extra workload for the nurses that are presently on duty in the ER. Now that we have these nurses with us, or our nurses with us, they are doing some of those things themselves. So they are, checking vitals. They are even able to do charting. So if we are up in, say, Mansfield, and we have to head to hospital with someone, they're on their tablet, they're registering them, they're putting in notes into the chart, they're covering off all of these things. So it's adding to the efficiencies. So when we get to ER, they already know that we're coming. If they're able to, they will have a bed set aside. And because our nurses are specialists in crisis, their clinical opinions and judgments hold a lot of weight with the physicians in the ER. And it should be noted as well that there are times where Michelle and Angela will be acting as the crisis nurse up at Headwaters. So they would be the person that is essentially responsible, would you say?
Or go. That's on, okay. Yeah, a big portion is if we're bringing them in, they generally know, like, we're not really here for another full assessment, that they need to be there. And I'm going to say our wait times, we're in and out of there within 40, 45 minutes now, sometimes a lot faster, but that could have been a 4-hour process before, like tying these guys up off the road and that kind of thing.
And there's been a lot of relationship building up at the hospital as well, because even if we don't have a person that we've apprehended to bring to hospital, sometimes we go up there, we check in, and we're building that relationship, because ultimately we all have to work together because we're trying to accomplish the same goal. And by that, doing that networking and relationship building, it's having a positive effect all around. And not that I want to backtrack too much, but when we look at the apprehension rates detachment wide over the period of time that we've had our nurses, a lot of this is also through osmosis, because we're going to have our 2 clinicians that are with us, and then we have our 4 part-time officers who then will become on that shift the subject matter expert. So they're often getting consulted. And what we're finding is that this education is just it's permeating throughout the detachment area, which is leading to better outcomes for the people that we're serving.
I was just going to add very shortly, one of the things that really improved with Headwaters when we came on is that because of the support with the leaders at Headwaters, we were able to have a room set aside specifically for the clients that we bring in that is a safe-ish room. And if we call ahead with someone, they have that ready for us. We go in, we do all of the paperwork ahead of time. And that's gone a long way in really building those partnerships and getting the officers in and out as quickly as possible.
It's amazing. So if you think about it there's always a financial spin here too, right? And the financial spin for me is we had people as officers who had to essentially babysit. That's not very politically correct, but that's what they were doing, right? They're waiting. Now we're not having to do that because there's an intervention that's early and there's professionals who now can offer a service and help people in a faster way. So this is not only is it benefiting people from an emotive standpoint, but it's benefiting us all from a resources standpoint as well, which is phenomenal.
And like Michelle, I just want to reiterate what Michelle said earlier, was that the hospital knows that we're not bringing anybody in that doesn't need to be in the hospital. We've done everything we can while we're out there. We've done everything we can to prevent or to help with the crisis, and we cannot keep them safe. And that is why we're bringing them in. So the process is much quicker that way as well, because they know already that all of that back work has been done. So
we have access to something called Connecting Ontario on the road, so we can pull up their medical records, and you can go back as many years as you really want. So it gives us and the officers kind of a history, and then that makes this just coming into the ER a whole lot easier for them to have the background information. It does.
Only because I'm very acutely aware of PHI. The personal health information is not something that's shared with the officer, just for the sake of clarity. The clinician's judgment is shared with us, but it's certainly not their health history by any means that is shared with us.
I just, you see things now, and I think, Mayor Post and I would see things in our time that I don't think 5 years ago, before we got into elected office, that we would have been exposed to that we see today. And it's certainly so important what you do. And I think about what I see, and I have the utmost respect for what you're describing in the situations, because I see these things happening and I think, oh my goodness, like I am not capable of intervening or solving or whatnot. That's not what we get to do. We have professionals like yourselves that are here and doing them. And I'm just so grateful that you're here. And it was so interesting to hear the spiel. And James, I heard you speak a couple of years ago. It was interesting to me then, and it's evolved since that time. And I'm trying to place the last time that you were in front of the Police Services Board, but it's been in the last 5 years because that's my time frame. But it's come further in that time since your last update. And so I'd love to hear from you again in a couple of years and see, and just thank you so much to you and your team. It's just great. It's really, really good. So Board members, does anybody else want to say anything before we say? Yes, Mayor Post, please.
Thank you. I think we all know that crisis doesn't happen Monday to Friday, 9 to 5. So when Angela and Michelle and James, when you guys aren't available, and I know you said that there's 4 part-time officers, who's filling the gap during those times? And is there a need for additional times? As we get, as politicians, we get a little bit of FaceTime with the provincial members sometimes. And if there's things that we should be advocating for, we want to be able to do that. So the needs of this program are especially interesting to me, and how we can help to fill that gap. And what are those needs, and what is the funding that you need to make it better or bigger, or any of those things?
So right now, between the officers, there's always somebody on every shift to cover that. Between Ange and I, we're unable to cover the entire schedule, right? We would love another person or two to be able to do that 24-hour coverage, right? I don't think right now the grant is set up for 24 hours. We're doing our best to cover as much as we can.
So what is it covering right now?
Say about 6 days a week.
Yeah, I think we're averaging about 6 days a week. The
I
difficulty,
mean, yeah.
And if there is something that happens in the off time, what's the process then? If people are used to during the day that they know they can contact you guys, and you guys are being dispatched out to that, if it's happening outside of those hours, what's the process?
well, one of the things that MCERT has done and is going to continue doing are training sessions with officers to talk about the different disorders. I mean, there's really only a very high level view needed of that for them, to talk about apprehension authorities and things such like as that. So, I mean, our officers all go out and they do a great job. I mean, 99% of the time that officers are interacting with public, what we're doing is resolving things, right, and de-escalating. I get calls all the time when I'm not working, and I'm totally okay with that. And I know Michelle will, Angela will. Would we love to have 7-day-a-week coverage? I would love 7-day-a-week coverage, 18 hours a day. Can we justify that statistically right now? I think it might be a hard sell. But I also think that the more time or the longer that MCERT is out there working, the more we're going to be able to show that need statistically for more funding, because we already know the program works. It would work a lot better if we had more people. But let's be realistic here. Everyone in emergency services is working with less people right now, whether it's from retirements, transfers, things like that. COVID, yeah, there's so many different reasons. Yeah, I would personally love another full-time officer, another full-time and another part-time nurse. Maybe, I'm sure we'll get there one day. Whether or not we're able to get there now, I don't think so.
I think my ask then would be if you can just keep us in the loop on data, and let us know if there is a spot that we are ready to advocate. Just give us that trigger so that we can plan for it and prepare for it and add it to our advocacy plans, and just keep us in the loop. I think that would be great.
Yeah, and
Amazing.
thank you,
Thank you.
as well for your advocacy recently with the program. It was very much appreciated.
It's excellent. Thank you, everyone. Really appreciate this. And at some point, Mayor Post, just look for you for affirmation. It would be incredibly interesting to share this in a very public forum at a council meeting at some point, if it was appropriate, with yourselves. But you know, it's something that people need to know that's out there. And I think, like, for me, it makes me feel at ease, like at peace, that, you know, there's this help that's available to those who need it. So anyway, thank you guys. Appreciate it very much.
Thank you.
Yeah.
Thank you.
Okay. So board members, can I have a motion to receive that report? Sorry, I didn't get to see Ken and Mayor Post. All in favor? Yes. Okay, that's excellent. So at this point in time, we are dusting off the ward report and we are going to the corn report maybe. Are we doing that? Is it the corn report? Not the corny report, right? Yeah. So I'll turn it over to you. And what we've done in the past is there is a list of items that are here that you could speak to for sure. But we usually would go over the quarterly report and whatnot as well. Are you able to take us through that, or what would you prefer? Whatever's best.
It'll be up to you, to be honest. Questions here. This is my second day.
Yep.
And I was unaware of this.
No problem.
So I have really not.
John, did you?
You might be able to.
No, I mean, 2022 and 2023, we don't see a lot of changes in certain areas unless somebody wants to speak to anything specifically. I mean, I only saw, in the theft of auto, a spike there, but that's sort of a provincial issue. Was there any other highlights that there were questions about in that?
Board members, do you want to have an interactive session here? I've got a few questions that I could ask. Ian, would you like to ask a question?
Well, I just wanted to follow up on the Dufferin Action Plan. So board members will recall that we had a session with Terry in conjunction with our contributions towards the action plan, which under the Police Services Act is called a business plan, and the Adequacy Standards Regulations refers to it as a business plan as well. But that all comes out of the OPP strategic plan, which we don't have input on. And I think Terry told us that it was coming out, I don't know, shortly. I had written down June, but with a question mark, so it was hopeful. So just to remind everybody that when that strategic report comes out, that will then facilitate our getting back together with Terry or with Dean or whoever at that time to try to then hammer out the bits that go into the Dufferin Action Plan, which form part of our business plan under the PSA. So that's the sequencing of that.
Would either of you want to speak to that? Is there any updates from the OPP in terms of timelines for that?
I think it was like you said, I heard late May, which could mean June also. That's what we heard. Yeah.
You're in the presence of a bunch of keeners. So we were asked by Inspector Ward to feed into it. We met, we aligned as a group on what we thought was important. We fed it back to Inspector Ward, who seemed quite pleased that we took the time and energy to do that, it was great. It was a great partnership discussion, and we're just anxious to hear back and make sure that we're doing what we're supposed to be doing as a board. So that's what the pieces are there. Maybe I'll just go through then quickly. We did talk about Operation Lifesaver. We did that in closed. No updates that you want to share with the public at this time, because this is recorded now, right? Is there anything that you want to share on Lifesaver? And I don't mean to put you on the spot.
No, nothing new. We'll have the updates for the next one.
Okay, very good. The community partners discussion, a letter has been sent to Inspector Ward, and Mayor Post and I are going to be meeting with Inspector Ward regarding that. There was recently a Coffee with a Cop program, gentlemen, and that was at McDonald's recently, and my understanding is there's going to be other ones. The feedback from the community was that this was fantastic. My feedback would be is that I didn't know about it, so I would have loved to have gone. It sort of came out a little bit late, so if there was ability to promote it a little bit more and share with your community partners, we'd love to support you on that. People want to see the local police and to be able to shake hands and have conversations. So it was a great initiative. I don't know if you wanted to talk.
We did the last one in Shelburne, so we plan on circling back to Orangeville, sort of doing the main communities.
Very good. The other items on here, I don't know that we need to talk to the parking complaint. There was some items that we discussed. There was some concerns that arose, and I'll just quickly describe them. On 3rd Avenue in terms of stop signs and speeding. There was some traffic, community safety zone traffic issues where people were passing buses and whatnot in Settlers Creek, specifically in front of Spencer Avenue School. And then there is a continuing issue over at ODSS where there's parking and bylaw infractions, and we're getting, I don't want to say numerous complaints, but sort of more than a few complaints about issues that are occurring in that area and pick up and drop off. And for anybody who's watching this, our police have committed to looking into these items, and you certainly won't know when they're there or how they're going to be there, but you're aware of those situations, and I guess have taken note of them. So sharing that with the public, is that a fair comment, or did you want to? Did I frame that up in a way that is appropriate?
Yep. So, some of these are new to us, so we're just sort of starting out with them, but yeah, we'll address them going forward.
Okay. And then the last item that was as part of this kind of omnibus bill here that we put together was there was a letter from our Mayor Post, to our MPP Sylvia Jones regarding the mobile crisis response team and ensuring that funding was there. And that was the group that was just here doing their presentation. And Mayor Post wrote a very convincing piece, and the province has followed up, and it looks like that funding is there for us. So congratulations and thank you to you, Mayor Post, for that. And then I don't think there's anything else, unless there's things that you wanted to speak to in the ward report area here. You love the ward report, don't you? I can tell.
I have nothing else. I can just assure you that if I'm here for the next one, if that does take place, it'll be a little bit more, I'll have a little bit more background for you. And
just out of curiosity, board members, there's quite a few statistics in that report. The calls for service and different items. Is there anything specific that you wanted to mention in the report? I don't have anything at this time. It is very comprehensive. We've been through it numerous times. I don't think there's trends that are surprising. There is a lot of service calls, which is interesting, but outside of that, I didn't find anything noteworthy. Anyone want to speak to those or chat one last time? Ian, you want to? You're just on mute, sir.
I think our new protocol on that statistical report that Terry gives at our meetings is to proactively transfer it over to council so that they don't have to dig through our minutes to get at it. So just assuming that going forward, that will be done each time.
Yeah, and just as a policy update on that, are you doing that, Mary Lou, or am I doing that? Just to make sure we're clear with each other. I'm fine with it if you want it to. Sure, I'll follow up then with council, and I'll copy yourself. Okay, so based on that, can I have a motion to receive the truncated ward/corn report? Mayor Post, Ken, all in favor? Yes. Okay, thank you, everyone. So I think, gentlemen, that in fairness to your time, you're certainly welcome to stay if you'd like, but we're going to continue on, and I don't think there's anything left for the two of you. So up to you what you'd like to do. Okay, very good. Can we just take a 1 minute recess here, ladies and gentlemen, and we'll let these gentlemen clear out, and we'll come back here. We'll just keep the cameras on, and we'll give them 1 minute. How's that? Okay, board members, so is everybody back? Ian's there. Just give Ken a minute. Okay, well, why don't we move forward with item 9? Oh, there he is. Ken is back. That's great. So this item 9 is the bail reform letter, letter that was sent off, written by the boards, and essentially it was a board letter. It's on page 36. It's in the documentation. I don't think there's any discussion topics here. Just more or less a motion to receive this report. Could I have a motion to do so? Ian and Ken. All in favor? Yes. So
Mr.
item.
Chair, I just had a follow-up on that.
Sure.
The letter was dated April 3rd. It went to a number of federal, provincial politicians and agencies. Just wondering whether any response has been received.
Nothing has come to myself. Mary Lou, is anything? No response.
So you may recall that this sort of originated from a presentation made to Zone 5 from the Wellington Police Services Board, and the next Zone 5 meeting is on June 6th. So I'll follow up at that meeting to see if anybody has received a response, and also to what extent other Zone 5 boards wrote these kinds of letters, and then I'll report back to the board in June.
Okay, I think that would be great. So Mary Lou, on the next agenda, can we just put a little spot on the open agenda for Member McSweeney? So item 10, which is on page 38, is the POA board. It's just essentially a report, and Councillor Rick Stevens sits on that board now and has shared the information back with us. A few interesting subjects in here for sure. I thought the fine revenue versus budget was interesting, so it's up significantly. Net revenue is up, which is good. These are all indications that the POA courts are getting back into a regular rhythm post-COVID, which had slowed right down. And I think the most reassuring thing is finally ahead of 2018 POA revenues, if you're reading that report. The court is fully hybrid, and trial time was previously, the worst it got was a trial time was 22 months. Now we're down to 15 months out, which is still really quite a long time, but significant progress has been made. Those are my observations. Board members, anybody else have any observations? I'll just ask that question if there's something you wanted to speak to on this. Seeing none, I'll ask for an acceptance of this report. Can we receive the report? Mayor Post, can I have a seconder, please? Ken, thank you. All in favor? Yes. Okay, so that is item 10. Item 11 is the grant update, and this grant update speaks to 11.1, which is the RIDE grant, 11.2, which is community safety, and 11.3, which is the victim support grant. Does anyone on the board wish to speak to this item? Mary Lou, did you want to say a few comments on this item, or do you think? No, or does board members have questions of Mary Lou? No, seeing none. Why don't we just receive the item then? So can I have a motion to receive 11.1, 2, and 3? Member McSweeney, seconded by Mayor Post. All in favor? Yes. Okay, so that's unanimous. Thank you, everyone. Item 12 is review the post-March 21st meeting and the pre-May 16th, 23rd meeting with the meeting service standards. In my estimation, we did well when I went through these meeting service standards myself. Board members, is there any comments or questions on this item?
Well, being 100%, I agree with you, Mr. Chair.
Yeah, I don't think we can improve upon it at this point. So the only thing we could do is fall back, which we don't want to happen. Okay, so motion to receive this then. Ken? Can I have a seconder? Mayor Post, thank you. All in favor? Yes. Item 13 is the board member claims for special enumerations. There is a list here that takes care of all the events, April 3rd, April 5th, April 18th, and April 28th. The motion is to receive the item, but board members, would anybody like to speak to this before we receive? No? Okay. Could I have a motion to receive this report? Mayor Post, and seconder. Member McSweeney, thank you. All in favor? Yes, very good. Item 14 is on page 75, and this is the spring conference.
So, sorry, Mr. Chair, just that motion was to receive and approve. I think that's the way it's written, but just to clarify that.
I didn't say approve, I just said receive, so you're correct. I should have said, as clarity, it's to approve as well. Thank you. Thank you very much. Okay, so item 14 is the spring conference. And so we're in a bit of an issue here, and that issue is we don't have a member that's attending this at this point in time. I will declare that I am not able to fill the shoes in this personally, so that leaves others to declare their position. Mayor Post is shaking her head in a negative fashion. Ken is shaking his head, and that leaves we're down to one. Yeah.
I should go, but I can't. I fit it in, but I mean, we've paid for it.
I know.
So, and we're not going to get that money back. You know, it is what it is. But I will, if a hole opens up in my schedule, it's in Niagara Falls.
Yeah. The piece of it is, it's too bad is it would be incredibly interesting. And I think we as a board, you know, through the member that went, we would learn much. But at this point in time, unfortunately, due to unforeseen circumstances, we don't have someone attending. So it's a shame.
It is a shame because we should be there, because there's a number of issues on topics on the agendas that are topics that we have championed in the past. And but we'll get a report. We'll get a report.
That sounds fair. Well, I guess that's the end of the topic on item 14. So motion to receive item 14. Then Mayor Post and Ken, all in favor? Yes. Thank you, everyone. So item 15 is the action register update. This is a list of board projects and the progress that we're making. Would any board members like to speak to this item? Nope, seeing none, I think it's fairly straightforward. We'll receive the item. Can I have a motion to receive this item, please? Member McSweeney, Ken is second. All in favor? Yes. Okay, item 16. This is the section 10 objectives, priorities, and governments documents. We have, well, the intent was to discuss in closed and share in open. Basically, the background on this for folks at home is that it was a board brainstorming session, and it was talking about the future of what we would do in Dufferin with Inspector Ward. Vice Chair McSweeney, did you want to speak to this item at all, or?
Yeah, sort of the governance reform project that is has been on our agenda forever, but it's because it's gradually being completed. So as I will again report in closed, we go back there. The policies have been drafted. The cover governance memo has been drafted, and the next step is for the 19 policies to be rolled out in groups of 5 or so to the board for discussion at special meetings, 3 or 4 special meetings that we're going to have over the next month or so. Mary Lou is going to set those up after this meeting. And so we'll gradually get through those policies, approve them, and then as stage 2, and I've already drafted this, so we're in pretty good shape. There is a general service standards guide that we'll be looking at to make sure that we can develop a calendar of events throughout the year, which will make sure that we continue to be in compliance with all our governance requirements. So without predicting exactly when all that will happen, it will be this year, and it will be, probably early fall, but we'll get there. And then we will have, I think, a best practice governance structure that we'll share with others.
That's excellent. And you've had others reaching out, wondering about that project too, have you not?
I've already shared one of our revised bylaw with bylaw number 1, the procedural bylaw with Shelburne. They called to, because I think they're looking at what they need to do to transition from a 31 to a 10 board. So, not as far along as we are, but nevertheless, the idea is to share with the OAPSB and the zone 5 and whoever else wants to look at our template, and they can hopefully improve their own governance structure by looking at what we've done and reciprocate, right? I mean, we're never done. We can always learn from others as well.
Yep, agreed. Okay, board members, anyone else like to speak to this item? Seeing none, I'll ask that the item be received. Mayor Post, could I have a seconder? Ken, thank you. All in favor? Yes. Okay, so item 17 is the PSB website review. We did have our communications team from the town speak to us about this item, and they gave us some key updates in terms of things that we can do and help to improve the visibility of our website. Ian, did you want to discuss this any further? I had you down as someone that wanted to speak to this, or?
Yeah, just I think I don't know, how many members of the public are listening, but they may see it after the fact on YouTube. The board is focused on transparency, helping the public to be better able to access what we post on our websites. And the second piece of that is we're very proactively looking at the content of our website to make sure that we are disclosing as much as we can to the public in terms of our process and the substantive parts of what we do, so that it's public information. And I think a lot of other boards in the province are doing that as well. But once again, we seem to be out there doing a lot of this stuff in a very proactive way. So we'll share what we end up doing with other boards, and we'll see where they go.
Very good. Okay, so can we have would other board members like to speak to this item? Oh, seeing none. Okay, can we have a motion to receive this report? Mayor Post, Ken, would you like to do that? Thank you, sir. All in favor? Yes. Okay, so item 18, this is the school bus stop arm program. It's something that we were investigating. Ken, actually, you took the lead on this. And since that time, it's included in the documentation is the communication with our acting CAO at the town of Orangeville, and just updating us on the very fact that Peel had abandoned the initial pursuit of this. And right now they are pursuing a new angle, and we're waiting on that decision. And acting CAO Innes has agreed to share that decision with us once it's come forward. I don't know the date or the anticipated date of that decision, but once we do from Peel, then I think it could form a basis for what we do in Dufferin. And my suggestion is we simply wait for that report at this time. Ken, would you like to speak to this item?
Yeah, I have a question, Chair Taylor. With the Premier looking at breaking up Peel in Mississauga, is this going to have an effect on the program? Or would Brampton still consider this program in Caledon?
My position would be I don't know. I think Mayor Post, you might have a better perspective than I do. I don't know, but we don't know would be the.
No, that would be my comment as well, is that yes, there has been a lot of rumor about what's going to come, and that may definitely impact where this goes, because I know it was Peel Region that was looking into it. But on that note, if I can just also add, we do need to look at something. So I know that Peel had abandoned that particular item, and it was basically because they couldn't find a way to make it cost neutral, which was problematic for the municipality. So that said, though, I've received several concerns from residents, but also from school bus drivers about the prevalence of this issue in our community. So we do need to be moving forward with something. So I think that over the next couple of months, we should make a decision, regardless of what Peel is doing, to try and figure out a way that we can move forward with a program of similar type. And maybe we can, as a police services board, maybe we can do some further investigation, but we do need to take a proactive approach to this, because at this point, we've got several issues happening in our community with this.
Very good. Board members, thank you very much, Mayor Post. My suggestion would be is that this stays as an active item. And just as a reminder, even if we just pass it by and say there's no updates, but we have a June, well, I guess we haven't really determined. We're going to discuss June meeting, right? And then we wouldn't meet over the summer. So either way, it should probably be on a June meeting and then it'll be on a September meeting. Okay, so thank you for that, Mayor Post. Motion to receive this item. Ken, thank you. Mayor Post, all in favor? Yes. Okay. Item 19 is on page 91. The false alarm reporting. This is an item that was added simply because when we first started investigating the false alarms, this thing was 3 or 4 pages long. Now it's minuscule, which is fantastic. It shows that the efforts of this board, the town of Orangeville, and our OPP detachment has really paid off. But there was frequent re-offenders on this list, and now I don't see that. And why, again, I just want to remind people, if they're watching this, why it was important is our OPP contract, we pay for calls for service, and we would have OPP officers going to the same call numerous times, and there wasn't an issue. So the idea was to penalize folks if they had false alarms, and that process seems to be working. So that's my take on it. Board members, would anybody else like to comment on this item? No, seeing none. Okay, could I have a motion to receive this item? Member McSweeney, Mayor Post, all in favor? Yes, thank you, everyone. So that's item 19 gone. Item 20, this is really a sad day for the board in my colorful commentary here, and that is that Member Mary Rose has decided to resign her position on the board, which is from a personal standpoint, we'll miss her greatly. From a professional standpoint, she was a extremely hardworking, knowledgeable, forceful individual, and will be missed greatly. So as follow-up to this, I did follow up with the province. I have let them know that Member Rose has put in her resignation. This is a provincial appointment, so if folks are watching this, council nor the Police Services Board has any input to whom the member is. You can apply online if you have the proper credentials, and you do so through the Ontario government site. If anybody'd like to contact me directly, I'm happy to send them that link. And then the province will interview you, and eventually someone will be placed on this board. And board members, we should all be prepared that it'll be some time before we have someone. It's a specialized skill, and not just anybody gets to sit in the wonderful chairs that we're blessed to do. So it's gonna take a little bit of time for this to resolve itself. Any questions or comments from board members?
For someone who's been through the process, it's a long process.
Yeah, you would know, wouldn't you, Ken? Yeah. Okay. So yes, please, Mayor Post.
I just wanted to publicly thank Member Rose for her contributions to the board. I've only been on the board a short time, and I can speak very passionately about what a great contributor she was to the board. So I wish her all the best in her retirement and her long time of public service. I know she's going to continue in some format, and I just wish her well.
Very good. Thank you, Mayor Post. Classy as always. Okay, so sorry, I got distracted there. Did we receive that item? We did. We did not. Okay, thank you. Could I have a motion to receive? Ken, thank you. Mayor Post, all in favor? Yes, it's passed unanimous. Okay, and then on page 95, item 21, this is approval of the public session meeting minutes from March 21st, 2023. Could I have a motion that, or excuse me, yeah, I guess we'll have a motion that the meeting minutes are received. I think Mayor Post and then Member McSweeney. Would anybody like to speak to this item? No, seeing none. Okay, all in favor? Yes, very good, that's passed. Question period, Mona, is anybody? No, no, thank you very much, Mona. No one's in the gallery. So question period is passed. Presentations, we've already done those. Delegations, correspondence, and reports are done. Item 27 is new business, and the new business is speaking about the in-camera session for DCAFs. Member McSweeney, is this is this appropriate here? Do you want to cover this, or how do you
Yeah,
want to
It's fine.
approach this?
Yeah, so I think we discussed it in camera, and decided to invite Jennifer Moore, the CEO of DCAFs, at our June public meeting to give us a little presentation about DCAFs, so the board can have an interaction with her in that role. And I understand, Mary Lou, I saw the email traffic earlier today that because of my schedule, and thank you very much, the board has accommodated my schedule, moved that June 20th meeting to June 21st. And I don't know whether you've heard back, Mary Lou, from Jennifer as to whether she's available, but we'll sort that out.
And since you're on that note, June 21st at 3:30, is that right, Mary Lou? 3:30. Okay.
And the only other thing I would say, just under new business, a different topic, and I'll say more about this in closed, is that the OAPSB is rolling out their education models on the new legislation, and they've asked me. I think they're looking at 8 guinea pigs in the province to take the modules initially, and they've asked me if I'll be one of them. So they haven't reached out and contacted me with the materials yet, but when they do, I'll be taking them, and then I'll give an update to the board.
That's great. Ian, so those modules that are coming out, all board members are expected to take these courses. Is that correct?
I think that's right. I don't know what the legislation will say about the mandatory nature. I think it'll be it will be express, but apart from that, our governance protocols would require us to keep up our continuing education on that.
And Ken, did you want to speak to that?
Will it mirror the province training? Because the provincial appointees have to take training to the Solicitor General.
Yeah, I have no idea. No idea. I haven't even seen the modules yet. So,
yeah.
We'll
personally, I welcome it. Like it feels like it's time again. You know, it's renewal and time to. We've gone through quite the transition, and now it's time to regroup and start to learn, and then put those items into at work and the work that we do. So I'm ready for it. I'm looking forward to some new ideas and training on this board. So that'll be great. So I guess new business, we don't need to do anything with that, right? You're not. No, Ian, you're good.
Yeah, no, we can receive my
okay.
Update.
So I have a motion to receive that item under new business. Ken, thank you. Mayor Post, thank you. All in favor? Yes. So board members, we're going to adjourn at 6:18. We're going to leave this meeting though and go quickly back into close just for a quick regroup. Okay, so can I have a motion to adjourn, please? Mayor Post, Ken, all in favor? Yes, and if we could sign into the closed link, that'd be great.